So, I just like to start the session by thanking all our doctors for the wonderful work that you guys have done in the last 2.5 years, keeping us safe. Thank you again to all our doctors. Um, Doctor, how we'll do this session is like this. We are going to keep everybody on mute while you're talking. And before you start, tell us a bit about yourself. I know you have come on to Tare before, but tell us a bit about yourself, what you're doing, not you a bit about you as a person, and then we'll start our session.
Okay, at the outset, sorry for my background. I know I'm in the hospital and I cannot change my background. So, and there is no better place. By the way, I work at Tata Hospital currently, and I'm in the geriatric oncology section, where we deal with only patients above the age of 60 years. So, I am currently in the geriatric oncology section. क्या मैं हिंदी और इंग्लिश में बात कर सकती हूँ?
Yes, perfectly.
ऐसे ऐसे कीजिए, अगर हाँ तो ऐसे कीजिए. Yes, because मुझे कॉम्बिनेशन में बात करना होगा. मुझे नहीं पता सब लोग मुझे समझेंगे या नहीं. So the thing is, मैं डॉक्टर अनीता हूँ. मैंने MD जीरियाट्रिक्स किया हुआ है. Pele, how I started this off is, let me tell you a little bit of my background. I initially did my master's in biochemistry, post which I did an international master's in international public health from Australia. Then I realized that I needed and what work I do should benefit my country in some way or the other. With all that patriotism, I ended up coming back to India. And then after that, I decided that yes, I want to do medicine, because I wanted to auditions on a one-on-one basis, and probably public pursue life, but never mind. I'm still achieving the goals that I need to achieve in my life, and I'm very proud of doing what I do. If you knew me, and if you probably interacted me, you would know how much I love my field and how much I love dealing with the elderly. And perhaps क्योंकि मैं अपने दादा दादी नाना नानी के साथ पली बड़ी हूँ, तो शायद इस वजह से भी मुझे बड़ों के साथ बात करना बहुत अच्छा लगता है. उनकी दुख दर्द शेयर करना बहुत अच्छा लगता है. ये बचपन से मेरी एक आदत रही है, इसलिए शायद दिस फील्ड जस्ट फेल इन माय लैप, एंड आई फील वेरी हैप्पी टू डील विद द एल्डर. यहाँ पे जहाँ मैं काम करती हूँ, वहाँ पे मैं सीनियर सिटीजन्स को देखती हूँ जो 60 साल के ऊपर है. एज पर WHO डेफिनेशन, जेरियाट्रिशियंस वो है जो 65 इयर्स के ऊपर के लोगों को ट्रीट करते हैं. पर क्योंकि इंडिया एंड लॉट्स ऑफ थिंग्स आर सराउंडेड अराउंड द एज ऑफ 60, एंड ऑल्सो हमारा लाइफ एक्सपेक्टेंसी अमेरिका और जापान की तरह बहुत बड़ा नहीं है, इसलिए हम 60 जो भी 60 साल के ऊपर है उनको देखते हैं. तो जो भी 60 साल के ऊपर पेशेंट्स आते हैं, हम उनको देखते हैं. पेशेंट्स जो इधर आते हैं ज्यादातर ऑब्वियसली सारे तो कैंसर के मरीज होते हैं, एंड दे आर अवेटिंग कीमोथेरेपी. तो जो पेशेंट्स मेरे पास आते हैं, मैं उनका असेसमेंट करती हूँ. असेसमेंट इन द सेंस एक कंप्लीट जीरियाट्रिक असेसमेंट होता है. और मैं एक्चुअली आज मैं आपके पास इस वजह से भी आई हूँ ताकि मैं बता सकूं ये कंप्लीट जीरियाट्रिक असेसमेंट क्या होता है. आई हैव बीन ऑन अ whirlwind sort of knowledge, sort of spreading my knowledge on the geriatric assessments, the need for geriatric assessments among the elderly. I believe it is very important. मुझे नहीं फर्क पड़ता आपको करना है या नहीं करना है, बट मैं ये बता सकती हूँ कि आपको फर्क पड़ेगा. आप करोगे तो फर्क पड़ेगा, इन द फ्यूचर फर्क पड़ेगा. अभी इमीडिएटली शायद फर्क नहीं पड़ेगा, क्योंकि अभी क्यों फर्क पड़ना चाहिए. अभी तो आप सब लोग कितने हट्टे खट्टे और अच्छे खासे दिख रहे हो और सब एक्सरसाइज करके आए हो, तो डेफिनेटली यू ऑल लुक वेरी नाइस एंड हैप्पी एंड लकी एंड वेरी हैप्पी. सो पॉइंट बीइंग इज point being that कि कभी ना कभी आपके लाइफ में करना जरूरी है। ये आपको एक बेसलाइन देगा, आपको ये बताएगा कि आपका करंट कंडीशन क्या है, और अगर कुछ प्रॉब्लम है तो आप उसको रेक्टिफाई कर सकते हैं ताकि फ्यूचर में उसे वो ज्यादा बढ़े नहीं। ठीक है। सो एज पार्ट ऑफ दिस जेरियाट्रिक असेसमेंट आई लुक फर्स्ट, पहला तो आपका डेमोग्राफिक्स, आपका बेसिकली एज, वेट, हाइट, बीएमआई, वो सब, और थोड़ा ब्लड लेवल्स वगैरह देखेंगे। इसके अलावा हम आपका मन का स्ट्रेंथ, फिजिकल स्ट्रेंथ, इमोशनल स्ट्रेंथ, स्पिरिचुअल स्ट्रेंथ, ये भी देखते हैं। और मेरे हिसाब से व्हाट इज द मोस्ट इम्पॉर्टेंट थिंग इज द टाइम आई गिव टू माय पेशेंट्स। द टाइम इज द मोस्ट इम्पॉर्टेंट फैक्टर। मैं आप सबसे शायद बात भी करना चाहूंगी कभी ना कभी ऑन अ वन ऑन वन बेसिस। Also, I want to know from you all what do you think is important from the geriatric perspective at some point of time. पर हाँ, मैं ये जरूर कहना चाहती हूँ कि जो चीज मैं सबसे इम्पोर्टेंट समझती हूँ और जो मैं देती हूँ मेरे हर पेशेंट को, और वो है मेरा टाइम। लगभग हर पेशेंट के साथ में लगभग 1 घंटा बिताती हूँ। कई सारे स्टोरीज आते हैं, ये बात करके मुझे कई सारे स्टोरीज की पता चलता है, कई सारे इंटरनल स्टोरीज का पता चलता है, जो बातें लोग कई दूसरे डॉक्टर्स या दूसरे लोगों से बात नहीं कर पाता है, वो मेरे साथ है। और इस तरह से हम पता कर सकते हैं कि पेशेंट को क्या प्रॉब्लम है, इज इट रियली फिजिकल और इट इज जस्ट अ मैनिफेस्टेशन ऑफ अ मेंटल। तो ये सब चीजें हम देखते हैं, एनालाइज करते हैं, और यही बात है जीरियाट्रिक्स का जो मैं आप सबको समझाना चाहती थी। दिस इज व्हाट आई डू। एम आई मिसिंग एनीथिंग, मिस्टर साले?
No, actually, this was very useful. I have a few questions actually. One of the
Yeah, please
things
go ahead.
that
I mean, I'm going to take all questions from everybody, so
yeah.
all of you can sort of ask whatever you
So one
want.
of my questions is, I we all have our family doctors, and we all know doctors over the last so many years, right? I may know one orthopedic because I've had a knee operation. I may know one chest specialist because I've had some kind of a cough. Why should I come to a geriatrician when I can go to my GP or when I can go to my their orthopedic if my legs are hurting? What can a geriatrician?
Will your orthopedic doctor give you 1 hour? Has any orthopedic doctor given you 1 hour of their time? Has there any doctor given you a holistic treatment? I'm talking about the elderly. Huh? There might be people who do it for the young people, but for the elderly, it's a different ballgame. There's a different kind of training you need for the elderly. For people above 60, you need an appropriate training for to deal with the elderly. It's not easy. Not everyone has the capacity to do it. Not everyone can cope with that kind of not just pressure, but that kind of conversations. Not everyone can be empathetic towards that. It has a different kind of training and mental strength that you need. And of course it comes also about, it also talks about personality of doctor, how they present to you. It makes a huge difference.
No, I'm actually a fan of the geriatric field of science. And the last conversation you and I had, a few days ago, you mentioned a very important thing called the quality of life versus the quantity of life. And if you could tell me, how can a geriatrician help increase the quality of life? I think that's very important to a lot of people, right?
Exactly. And that is my job. That is my role, to improve the quality of life. It's not just to increase your lifespan. It's to increase the quality of the life that you're currently living. And that is what I'm trying to propagate. I'm trying to even, whatever patients who come to me, mostly are cancer patients. So, rather, they are all cancer patients. So obviously, I'm going to be telling them how to improve their quality of life, depending on where they are having a lack, deficiency. How is there some walking issues? There are several aids available. So then I recommend those aids depending on how I feel that they can cope. And it's important that you follow up also. So then I know, I get a feedback. Okay, this patient is doing like this. So let us. Do we need to change the aids? Do we need to change any other aspects? Um, we look into the various activities of daily living, like bathing or transferring, going out. Are they able to use the phone? Are they able to spend money? Do they remember the monetary transactions? Are they going to be able to sort of converse with you appropriately? Lots of things, like right from dementia, Alzheimer's, um, movement disorders, all these things we look into.
Uh, Thank you, doctor. A question again related to this. How would, so, you mentioned this thing called geriatric assessment. Uh, what actually happens? I mean, we come to you and you give us a questionnaire, or you do a physical examination, or how does that work? And when should I get it done? I mean, what should be happening to me that I
There
should?
are, if you won't believe that I am trained to do geriatric assessments primarily. And since I tell you this a form, this, how you can imagine, pages are there. All these, we tell them to fill these pages, and after they fill the pages, only they come to me. After that, I analyze the patients. It takes about almost 1.5 hours per patient. Can you imagine any doctor giving you 1.5 hours of their time? No, you won't be able to imagine, because there is no time, that kind of time. So I spend that kind of time with my patients, because it makes a difference at the end of the day. If I want my patient to feel better, I know that they need my time. I know that they need my expertise. I know they need that kind of conversations, because it is important. And anyway, so these forms, they have to fill up and come to me. Based on that, I will make my assessments, or do a physical assessment, mental assessment, emotional assessment, those kind of things. Yeah.
So when do I decide to come to you? What is that trigger by which I say, okay, fine, now I don't need to go to my GP, or I don't need to go to my orthopedic, but I need to come to a geriatrician? When does that moment happen?
Any problem you have from head to toe, if you are above 60 or above 60, you can approach a geriatrician. See, you can approach a GP also, you can approach an orthopedician also. But like I always say, there is a difference. There is a different training process. There is a different learning process. There is a different expertise you get when you approach a geriatrician.
Okay, before I throw it up, let the audience ask questions. One last question. If you had to give us a tip or a couple of tips about how to increase our quality of life, right? I mean, we've just been through 2.5 years of sitting at home, feeling very depressed, thanks to COVID. And we need to get back to our lives again, safely, obviously. What do you think are the one or two things that we should do as seniors to make our lives happier or increase our quality of life?
Walk around in the sun at least for half an hour in a day. Definitely, either with help or without help. It's very important to expose yourself to sun. Even if your calcium levels are good, please expose yourself to sun. It brings a different kind of vitality to the body. It's important. That is the main thing I think I advise all my patients: exposure to sun. And be awake during the day hours. Try avoid sleeping during the day as much as possible. But because what happens is, if you sleep in the day, as it is, you get less sleep. If you sleep in the day, then raat ka bhi neend kharab ho jata hai. So then you are not able to sleep at night. It does not make sense. Then people complain of insomnia, जबकि actually insomnia नहीं है. वो दिन में सोए हैं और रात में obviously जगेंगे. वो हम नहीं चाहते. तो as much as possible keep some activity in the afternoon so that you are not sleeping.
Thank you, doctor. Everybody, we will take questions. Just unmute yourself, ask your question. Remember, the doctor cannot answer any specific question relating to an ailment because that the doctor will have to examine you. But anything general we can ask here. Please unmute yourself, ask your question, then mute yourself again so that everybody can hear. Anybody? We have pin drop silence, which is nice to see. Okay, so luckily we don't have questions. So what we could do is
No, I think Asha Chotrani has some question.
Okay, you need to unmute yourself. I can't seem to. Please unmute yourself. If you don't unmute yourself, we can't hear you.
I just wanted to tell that I get up very early in the morning. So I need to sleep in the afternoon. Because if I don't sleep, then I feel very, very tired in the evening. So what is the question for that? Because as it is in the night.
But then does that affect your night sleep?
No, it does not. I love to sleep all the time.
Okay. Then it's okay.
Then it's okay. No?
God bless you.
Thank you.
Any more questions?
I have a question. Yeah. Saleh, can you hear me?
Yes, Lawrence. Very
Okay, so I was reading that after the age of 60, people need less sleep. I don't know, there's lots of conflicting research. What
there is no
feel,
need. It depends on how much you are satisfied with.
Okay, there's no standard hours for...
No.
Doctor, what about things like staying connected? And I don't mean internet connected. I mean talking to other people. How important is that for?
Absolutely, 1000%. You hit the nail on the target. That's like the most important thing on the planet, I think. Loneliness is a big killer, and post COVID, that was one big problem I had to deal with. Literally, that was a one single major problem that a lot of elderly people were facing. Not just elderly, even young people were facing loneliness. So I think being connected is so important. If you want, you just go down and talk to your friends, or just call up, if you can call up somebody, some relatives, some children, some friends. Just find somebody. You can just talk something small things, what happened to you in the day. If you don't have anybody, you just probably can go down in the garden, or if you can walk around the garden, or just take a walk around your own place. If that should definitely actually, these are things that I will tell you, you can do it. But finally, what matters is what you like, what makes a difference to your life, and what you feel like doing. That's what matters the most. So if you like dancing, please dance, put the volume on high and dance. And it doesn't, age is not a factor for dancing, let me tell you that. So you can dance anytime, and you can just put loud music. What you used to do as a child, Mr. Lawrence, can I ask you a question? What are the things that you loved doing as a child?
Playing all kinds of sports, and I still do.
So do you still play?
Yes.
Do you still play? What do you play?
Well, I'm fortunate to have some friends who play tennis. So I
Absolutely
play tennis.
fabulous. So you play lawn tennis, or you play table tennis?
It's like a lawn tennis.
Oh my God. At your age, you're playing lawn tennis. I can imagine you're really fit.
Well, I was fortunate. I was managed to have people who I could play with continuously. If I had stopped, then it would be a problem starting again.
Okay. Fair enough.
But I have another related question. Somewhere I was reading that as you get older, you're doing less physical and less mental activity. So we need to cut down on food. Is that correct?
See, now that is very varied, definitely the interest, as you age, the interest in food decreases. Yes, you can reduce the food slightly, but you don't have to make a major reduction if you're okay, if you're health wise okay, and if you're active. Basic idea is that you should have enthusiasm to work, and you must have enthusiasm to go out, play, and all that. It doesn't matter how much you eat.
Anybody has any other questions? We can take one more. Okay, I think then we can call it. Yes, yes, Lord.
I had a thought. What I had noticed that as we grow older, we have less activities, less work, regular work. So we sit at home and we end up eating more. We just go to the fridge and eat. So we tax our body to just consume food, but we are not absorbing it. It's just putting pressure.
So that's what, there is a difference between the bodies of an adult and a elderly person. Even in the way that the medications that we consume, the way it gets metabolized and discarded from the body is different between the adults and the elderly. And this difference we have to make out. I mean, rather not you, that you have to understand that there is a difference. That is why there is a dose adjustment when we give drugs to an elderly as compared to an adult. These things are different. That is the reason we have something called as geriatrics, which is training in study of medicine for the elderly, which so that we know there is an adjustment. There are many drug interactions that occur, especially in the elderly, when as you age. The body some bodies tend to have a reduced immune system, and therefore they react differently, and that we learn as part of our education, etc. So that's why that's why the treatment of elderly and becomes a little different from that of young adult.
Thank you. Any other questions? Or should we?
One.
Yes, yes.
One last one. In India, has the life expectancy increased? What's the average life expectancy of an older person?
It's supposed to be around 69 to 74.
Okay.
Yes, Lawrence, it's actually increased significantly. There's a recent report about 4 years ago that came out, which shows how the increase actually happened, and it's getting better.
It's getting increasing. Need Okinawa, place like Okinawa or very few places have 100 years of life expectancy, but otherwise most places are around that, whatever we discussed.
And it differs from state to state, and a lot of other factors.
Yeah.
Any other questions? You know what, doctor, we need to do a session with you at a different time on what you actually do at Tata's, because that is exciting. That I know very technical and a bit scary. I know because you and I do talk, and I know that what you do there is amazing, but we need to have another complete session on that.
Yeah, I want people to understand what happens in Tata is what we do, and this is only for elderly, so it makes a difference.
I think we should schedule one, say, a couple of months or maybe even earlier on this, because I think the C word or the cancer word is a very scary word.
Yeah, scary.
It's a word I don't want to hear actually ever. But I know people like you are using your skills to make lives better.
Yes, it's not that bad. It's not as bad as it sounds at all. Once you say cancer, people get scared. People start sobbing. They just give up on life. But that's not the truth. It's not like that. If your mind,
we should have a session, maybe a month and a half on this. I don't know if I want to attend it, but yes, I know we all should. So thank you very much, doctor, for this lovely talk. We hope to see you again soon. And again, thank you for doing what you do to keep us all safe. Thank you.
Thank
Bye-bye.
you.
Thank you. Thank
Bye.
you.
Bye.